Diabetes. Types and management. Diabetes is a chronic disease that affects millions of people worldwide. It is a condition where the body is unable to properly process glucose, leading to high levels of sugar in the bloodstream. This can cause a range of complications, including damage to the nerves, kidneys, and eyes, and an increased risk of heart disease and stroke. In this essay, we will explore the different types of diabetes, their causes, and the various strategies for managing the disease. There are three main types of diabetes: type 1, type 2, and gestational diabetes. Type 1 diabetes is an autoimmune disease in which the body attacks and destroys the cells in the pancreas that produce insulin. This results in a lack of insulin production, which is necessary to transport glucose from the bloodstream into the body's cells. Type 2 diabetes, on the other hand, is a condition where the body becomes resistant to the effects of insulin, leading to high blood sugar levels. Gestational diabetes develops during pregnancy and usually goes away after delivery, but can increase the risk of developing type 2 diabetes later in life. The causes of diabetes vary depending on the type. Type 1 diabetes is believed to have a genetic component, as well as environmental triggers, such as viral infections. Type 2 diabetes is closely linked to lifestyle factors, such as poor diet, lack of exercise, and obesity. Gestational diabetes is thought to be related to hormonal changes during pregnancy. Managing diabetes is a complex process that requires a combination of lifestyle changes and medical interventions. For type 1 diabetes, the primary treatment is insulin therapy, which involves injecting insulin to regulate blood sugar levels. Type 2 diabetes can often be managed with lifestyle changes, such as a healthy diet and regular exercise, although some people may require medication or insulin therapy. Gestational diabetes is typically managed through a combination of diet, exercise, and insulin therapy, if necessary. One of the key components of managing diabetes is monitoring blood sugar levels. This involves checking blood glucose levels regularly, usually several times a day, and adjusting insulin or medication doses as needed. People with diabetes may also need to monitor their blood pressure and cholesterol levels to reduce the risk of cardiovascular complications. Diet is another important factor in managing diabetes. A healthy diet for people with diabetes typically involves reducing the intake of refined carbohydrates and sugary foods, and focusing on foods that are low in fat and high in fiber. Exercise is also essential, as physical activity helps to improve insulin sensitivity and lower blood sugar levels. Regular exercise can also help to reduce the risk of complications associated with diabetes. In addition to lifestyle changes, There are also several medical interventions available for managing diabetes. These include medications, such as metformin, which helps to improve insulin sensitivity, and newer drugs, such as SGLT2 inhibitors and GLP-1 receptor agonists, which work by reducing blood sugar levels and promoting weight loss. For people with type 1 diabetes, insulin pumps and continuous glucose monitoring systems can help to improve blood sugar control. In conclusion, diabetes is a complex and chronic disease that requires ongoing management to prevent complications and maintain good health. Understanding the different types of diabetes, their causes, and the strategies for managing the disease is essential for people living with diabetes and their loved ones. With proper management and support, people with diabetes can lead healthy and fulfilling lives.